Welcome back. In this lesson, we'll explore how to assess a client's skin laxity using the pinch test and why setting realistic expectations is crucial for client satisfaction. By the end of this lesson, you'll know how to perform the pinch test to evaluate skin elasticity, how to explain healing timelines and expected results to clients, and when to recommend follow-up treatments, and when to suggest surgical alternatives for excessive skin laxity. Let's get started. One of the easiest ways to determine if a client is a good candidate for plasma fibroblast is the pinch test. Here's how to perform it. Gently pinch the client's skin between your fingers and observe how quickly it snaps back. Let's look at the following examples. If the skin is loose and wrinkled, they are a great candidate for skin tightening. If the skin is thick and elastic, snapping back quickly, there will be limited skin tightening results. Plasma fibroblast will only stimulate collagen growth to slow the aging process. This test helps you set proper expectations so the client understands what results to expect based on their skin type. Of course, every client expects instant, dramatic results, but it's our job to be honest about what plasma fibroblast can and cannot do. Some clients may see immediate improvements, but full results take 8 to 12 weeks as collagen builds and the skin tightens. Deeper wrinkles may require multiple sessions or a combination of treatments like Botox to relax the muscles. I always advise my clients to combine plasma fibroblast with Botox for movement lines like frown lines and the deep frown line 11s between the eyes. Plasma fibroblast tightens the skin, but it does not stop muscle movement, so Botox can help prevent future creasing. When surgery might be a better option. Please always be honest with your clients. If they have excessively deep wrinkles or severe loose skin, plasma fibroblast is not a replacement for surgery. Plasma fibroblast treatment works best on superficial to moderately loose skin. It cannot provide the same results as a facelift. Your reputation is worth more than making a quick buck, so always prioritize client satisfaction and realistic outcomes over financial gain. Healing timeline and follow-up treatments. Healing after the first plasma fibroblast treatment can take between 8 to 12 weeks. During this time, the skin regenerates, collagen production increases, and results gradually appear. When to schedule follow-up treatments. Follow-ups should be scheduled between 8 to 14 weeks, but never before 8 weeks. The skin must feel completely normal to the touch before doing a follow-up treatment. If the skin still feels tender after 8 weeks, wait longer before proceeding. Do not exceed 4 months or 16 weeks for follow-ups, as waiting too long may reduce the effectiveness of the second treatment. Why does timing matter? The goal is to build upon the initial treatment while the skin is still in its active healing phase to ensure maximum improvement. Healing phases. Let's take a look at the typical healing stages after a plasma fibroblast treatment. Days 1 to 5, swelling and scabbing begin. Days 6 to 10, scabs start to fall off and redness reduces. Weeks 4 to 8, collagen builds and the skin starts to tighten. Weeks 8 to 12, full results appear. Every client heals differently, so it's essential to let them know what to expect at each stage to avoid unnecessary concern. Great job! In this lesson, you learned how to perform the pinch test to determine skin laxity, how to set realistic expectations about treatment results, when to schedule follow-up treatments and when to suggest surgical alternatives, the healing phases and what clients can expect over the first 12 weeks. Don't forget to download your pinch test guide and healing phases PDF. In the next lesson, we'll dive into post-treatment do's and don'ts and how to manage side effects. See you there.